Every person within our community is important, and the children and families that come into our care are at the end. They need the support so that they can go on, so that their families can stay together, so that they're going to be successful.
These are the kids that have been labeled that these are the bad kids. And honestly, these aren't the bad kids. These are the kids that are just misunderstood and nobody knows how to speak their language. And we're fortunate enough to know that in our building, we figure out their language.
I think it's really hard sometimes for people to envision that, you know, a 6, 7, 8-year-old could be struggling with so many things, but it's true, and it takes a lot of courage, you know, to reach out and get the help that you need and recognize that you need support from others.
They're in a crisis state. It's basically the I.C.U. of mental health for children. Those youth are at their most vulnerable, and this is when we can make a difference in their lives, and we really have to do everything that we can to set them up for success. The We Care for Kids House is an in-house facility. They've got all the amenities of home. There's dining rooms, living rooms, private bedrooms, laundry facilities, a pool, a gym. It allows for staff to have the room that they need to create their treatment plans and have offices and be able to meet with families as well. So it's really set up for state-of-the-art treatment.
The Family Learning Place program has 14 clients, so about half of which are residential and half of which take part in our milieu program, which is a school component as well as after school.
The intensity of our program at times even requires the child leaving the home, and of course for children 6 to 12 years of age, that's the last thing that you want to do is remove them from their home environment, their community school.
Mental health doesn't start at 9 a.m. and finish at 5 p.m., right? It's ongoing, and they're there. They have, you know, several workers, child and youth workers, social workers, all types of different professionals there to support the needs of the children.
When they get to us, it's at a crisis state where they feel as a family and they feel as a community that they no longer have any resources left to help these children.
My daughter Alicia showed signs of ADHD qualities at school, at her community school. She would, you know, interrupt in class and always want to be center of attention and mimic the teacher, being loud and always being timed out at school or going to the principal's office. And with the help of the Family Learning Place, she's now being focused on, you know, the tasks at hand. She's learned that ability to take that back to her community school and really excel.
I had my own difficulties with some anxiety and a bit of depression. I was struggling for a while, but I didn't really know what was going on, so it was nice to kind of have a better idea of what was happening to me and know that there could be help available to me and there was support and that I didn't have to continue on the path that I was leading. And I really do attribute, you know, where I am today to that experience.
They are living with us 5 days a week, and we're sort of replacing their parents and their guardians for the most part for the majority of the week. So there's a lot of hugs, there's a lot of affection, there's a lot of things like that that goes on because these kids are just so young and they're away and in a difficult environment.
It does at times break our hearts as well, but we know that we're getting them to the successful place by saying, you want to be home with mom, so we're going to teach you the skills on, you know what, mom's asking you to listen, which seems like a basic skill for a 6-year-old, but they really need to know the plan, and that's what we do there, is teach them.
They have to have that level of comfort, right? You know, if you were just in a hospital room and, you know, you're expected though to act as though you are at home and do the things that you would do at home, it's just not going to work.
A kid has a broken arm, you can see a cast, you can visually see it. With mental health issues, you don't really see it. It just comes out through their behaviors.
You don't want mental health or kids as young as 6 years old to feel like they're in a hospital, because then they look at themselves with a stigma, I'm sick, there's something wrong with me.
You don't know where to go. With their help, you have hope and there is a light at the end of the tunnel.
It's so important that these families and these children get help, because the whole community will benefit when they leave the program and they have the new skills and they can go back into school and that child can say, I'm happy, I feel successful. That family can say, we can do it now.
At We Care for Kids, we feel very fortunate that the We Care for Kids house is already built and those kids are in that home. But there's still work to be done. We still have to finish paying for the building, and Windsor and Essex is so generous, and we're just counting on them to pitch in.